So good afternoon, Stephanie. Thank you so much for taking time to meet with us today. Good to see you.
Nice to meet you. Thanks for coming in.
Stephanie, we are with the Academy of Nutrition and Dietetics, and we represent over 112,000 credentialed professionals. And specifically in Montana, there are just over 450 credentialed practitioners. And what we want to do today is talk to you about the Medical Nutrition Therapy Act and also talk to you about our child nutrition priorities. But before we get started, we thought we would just start, since it's a small group, and give everyone on the call a chance to introduce themselves. So Hannah, do you mind starting?
Sure. Thanks, Liz. Hi, Stephanie. Nice to meet you. I'm Hannah Martin. I'm a registered dietitian, and I'm on staff with the Academy of Nutrition and Dietetics, covering our healthcare portfolio. And Manju, I'll tap you to go next.
Thank you, Hannah. Hello, Stephanie. Nice to meet you. I am Manju Karkare. I am a past public policy coordinator for North Carolina. I am a registered dietitian nutritionist practicing in private practice for the last 10 years. I'm going to pass it on to Ariane.
Thank you so much, Manju. Hi, Stephanie. Very nice to meet you. Thanks for having us today. My name is Ariane Corbett, and I'm also a registered dietitian, and I'm a member of our Legislative and Public Policy Committee. I work in the child nutrition space. I have my own consulting business, and I provide training and technical assistance to school districts and community organizations that are working to better feed kids and just help connect child nutrition programs.
Great.
Liz,
so great to meet you all. I'm Stephanie. Oh, sorry, I didn't know. I handle healthcare, education, and nutrition for Senator Tester, and I look forward to chatting with you guys today.
Thanks so much, Stephanie. Well, actually, what we wanted to start off with today is just thank you. The senator has been such a champion for nutrition, and we know that we can always reach out to him. He's been very consistent with his policies, and we know that that has a lot to do with his staff and you and others who are working to know the issues and coming to ask the right questions. So just thank you to you and to your boss. We really appreciate your support. With that said, I know that we want to be mindful of your time, and we just have about 30 minutes. So what I'm going to do is I'm just going to turn it over to Hannah, who will really start us off and talk about the Medical Nutrition Therapy Act.
Thanks, Liz. I want to take a step back, Stephanie, and just ask you if you're familiar with registered dietitians, if you've heard of medical nutrition therapy, just to make sure we're on the same page before I dive into the bill and the policy and all of that.
Is a dietitian like a health coach? I know what a health coach is. Like there's one at my gym. Is that what you guys do?
So we are credentialed healthcare providers who work in all types of settings. You heard Manju talking about working in private practice and more of an outpatient setting. We have folks in ambulatory care settings in the hospitals, and those are just our healthcare folks. Then we have lots of folks working in school nutrition and many other areas, as Ariane was talking about. So we have to do over 1,200 hours of supervised practice on top of a bachelor's, soon to be a master's degree. So it's a very rigorous training for us to be members of the healthcare team and food and nutrition experts. And one of the core services that we provide in the healthcare setting is called medical nutrition therapy, which is really that healthcare assessment, reassessment, diagnosis, working with the patient to make a care plan for them and help them set and meet goals to improve whatever disease or condition they may be seeing us for, or even just general wellness. So our goal as a member of the healthcare team is to support them on the nutrition side in whatever chronic care management scenario we may be in today. So hopefully you're thinking like, gee, that sounds amazing. I hope everyone has access to that. Unfortunately, in Medicare right now, the only folks who can access the dietitian in an outpatient setting, so for example, going to see Manju, are individuals who've been diagnosed with diabetes or kidney disease. So you think any of the other conditions, eating disorders, cancer, heart disease, none of that is covered. And so you're really left with a system where people either don't have access at all, or it's really that minority of folks who can afford to pay out of pocket, which, older adults on a limited income is not going to be a huge number of folks. So we have worked with Senators Collins and Peters, who I'm sure your boss has worked with a lot on many health and nutrition issues, to put together a bill called the M&T Act that would expand the number of seniors that would have access to receive M&T from a dietitian. So we have put together a bill that would expand the list of diagnoses that would qualify someone upon referral, from their primary care provider or others, to see a dietitian. So the additional conditions we've added, and don't feel the need to write these down. I will send you a leave behind right after this call, but I'll just quickly go through them. Prediabetes, obesity, high blood pressure, high cholesterol, malnutrition, eating disorders, cancer, GI disease, including celiac, cardiovascular disease, HIV/AIDS, and unintentional weight loss. So that's really the core of what the bill would do. And the reason why we need this bill is because the original law that created M&T as a benefit in Medicare was too specific about saying just diabetes and kidney disease. And so Medicare says they really need a law passed for them to be able to expand it. So to fix that problem as well, there's another part of the bill that would give the Secretary of HHS the authority within guidelines, preventive services task force, medical, clinical guidelines, all of that, to make decisions in the future about further expansions, just as research and the literature develops and all of that. Because right now it takes a literal act of Congress, which is why we're here talking to you. And then the last thing the bill would do is slightly expand the folks who can refer for this service. So right now, only a physician, so your MD or your DO, can do the referral. I know in Montana, you all are going to have a ton of folks, PAs, NPs, others that are leading care teams. This is a huge issue in pretty much all rural areas in the country. And if your primary care provider is an NP operating, as their own practice, they are effectively locked out of getting M&T, even if they have diabetes or kidney disease, just because of that referral piece. So it would expand the referring providers as well, to include some of those folks. So I know that was a lot. I'll stop there. Happy to take any questions you have about exactly what's in the bill.
Can you take us back a little bit and tell me how your nutrition therapy helps people with these diseases? I know you listed a lot, but can you kind of give me an example of what that looks like?
Stephanie, I think that's a great question. And in fact, I think Manju has a great example that she could share with you.
Yeah, Stephanie, I can actually share a story of one of my clients with you, which relates very carefully to this exact same issue Hannah mentioned. She has been a client of mine before she was on Medicare, and was able to take medical nutrition therapy, advantage of medical nutrition therapy coverage as part of her private insurance. And fortunately, I am in network with a couple of other private payers as well as Medicare. And recently she called me and she said, I need to come back. I need to talk about, I just found out recently from my doctor, I have some heart disease related risk factors I need to take care. I don't want to go on medication. That is so much more expensive. I know I can work on this with diet. And she said, but I have to tell you, I recently switched. I'm on Medicare now. And I had to just take a breather. And I said, I have to tell you something. I'm really so sorry to, kind of break the news to you. But unfortunately, even, if your physician gives a referral at this point, that is something that is not going to be covered. And she said, you mean I have to pay out of pocket for this now? And I said, unfortunately so. And she said, but it was covered before. I have seen you before. I've been your client already. And I said, I know, but now you're on Medicare. And now I don't have a choice as a provider. And it really breaks our heart to tell someone that, yes, I know I can help you, but the huge barrier is that it's not covered. And the patient, the client, they feel such at loss that I'm actually losing coverage when I go on Medicare. And it's really hard for us to explain that. And I actually told her, I said, I'm working on it on every angle that I can. So that's one of the stories I can share with you.
Thank you. That's really helpful. I appreciate that. For the impacts of this bill, we always are thinking about the cost. Healthcare costs, obviously are continuously rising, skyrocketing. Can you tell me how much this bill costs? Do you have a CBO score?
So we don't have a CBO, an official CBO score yet for this bill. We would love it if your boss could support the bill and push the committee to ask for a CBO score. What we do know is that M&T, the payment rate from Medicare is a low-cost service. It's been shown to be cost-effective for many conditions. We're currently working on putting all of that information together for the wide range of conditions that are in the bill. But between the service itself not being very expensive and this being, it's only going to be patients whose provider thinks that this is medically appropriate. They're going to go through that shared decision making. It's going to be something the patient needs to want to do as well. There are all these sort of guide wires that will keep it from being, we don't think, a super huge utilization or huge cost service. So we're definitely looking forward to a CBO score and thinking about how that would help us with advocacy on the bill. Unfortunately, we don't have one right now, though.
Okay. Do you have any opposition to this bill? Have you heard from any groups that have concerns about it?
Hannah, I think that might be a great question for you to tackle.
Sure. So we don't really have any specific opposition to the bill. So there aren't groups that have come to us that are like, this is a terrible bill, you need to change it. I think on the Hill, we're hearing, just concerns about costs, wanting to be fiscally responsible and all of that, which we totally understand. And we're just trying to put forth a message about how this really is a preventive service, whether it's preventing disease in the first place or preventing comorbidities, worsening conditions, folks transitioning from one disease to even more costly ones. So not a whole lot of specific opposition that we're hearing.
Stephanie, it's interesting.
Sorry, go ahead.
Oh, it's interesting. And it's actually a great segue that Hannah brings up prevention, because today we wanted to talk to you not only about medical nutrition therapy, but we also want to talk to you about our child nutrition priorities. And so when you look at the lifespan and life cycle, we're talking about chronic diseases and needing medical nutrition therapy and intervention. But really, the other side of the coin is prevention and making sure that we're establishing healthy eating habits at the beginning of in childhood. And honestly, we know that research says that some of our greatest strategies and tools are the child nutrition programs to help establish those healthy eating habits at an early stage. So just curious if you have, if you're familiar with the child nutrition programs, or if it would be helpful to just give you a little bit of a background about when I say child nutrition programs, what exactly we're referring to.
Yeah, can you give me a little background on that?
Sure. So in our child nutrition program, range, there's lots of different things that we focus on, but particularly today, what we really want to focus on is the WIC program and also the National School Lunch and School Breakfast programs. And it's just been super challenging in the wake of the pandemic to see that chronic diseases have really illuminated the need to think about prevention and thinking about the establishment of healthy eating habits. And that school nutrition programs and the WIC program have been those programs that have been able to pivot really quickly in the wake of the pandemic. ironically, since they are our greatest asset to address prevention, and that they have been so impacted by the pandemic, we're really worried about their sustainability and what's happening moving forward in the wake of the pandemic. So what we are hoping we could do today is just share a little bit about what some of our opportunities are post-pandemic to really strengthen and expand the program and make sure that we have a pretty far reach for those programs. So let me just give you a quick example. And I know Ariane has so many specific stories that she can share, but what we're really looking at now is the expansion of the community eligibility provision. So that is a way that you can pay for universal school meals in school districts. And the Academy has a really strong position that our ultimate goal is to making sure that we have healthy school meals for all, right? So what we want to do is make sure that every child, regardless of income level, has a healthy start to their day and is set up for success both academically and health-wise. And we think the school nutrition programs could do that. And so right now, given the fact that in the House, we had the Build Back Better Act pass, and now I know you all are looking at this in the Senate, we really want to hear your thoughts about the child nutrition prevention, or sorry, the child nutrition provisions and the expansion of CEP in the Senate. And just curious if you or your boss are supportive of that or are familiar with those provisions.
Can you explain a little more? I know when I was reviewing the bill, I saw that there was kind of a change in the structure of that program. I think normally it was more focused on different localities, but now I think there's like a statewide option. Do you have any details you could share with me on that?
Oh, that's excellent question, Stephanie. So right now, the way that the provisions are set up is there is a statewide option, which essentially would allow states to opt in to provide universal school meals for all if they can fiscally make that happen, given their identified match of students who are eligible for school meals. What's great, though, is that we do have state level specific data that can explain what the specific impact would be in Montana. And that's actually a perfect segue to turn it over to Ariane, who can share a little bit more about that information.
Absolutely. That's why I raised my hand. So perfect. Yeah. So in Montana, we have currently 154 schools that have adopted community eligibility. So that means that if the community has a high enough need, then all children in the school eat school breakfast and school lunches at no cost. And so 154 schools in the state right now, with the expanded eligibility that has been passed in the House, we would be able to add an additional 142 schools. So that's about 41,000 kids that could be benefiting from school meals available at no charge. If the state of Montana adopted that state community eligibility, we would be able to reimburse about 60% of the meals at the highest federal rate. So would be a really great win for Montana. I mean, just a really great, wonderful win for children. And we would be able to meet a lot of the needs. I think we've seen this year and last year with the free school meal waiver that so many more students are participating. We've eliminated the stigma that's associated with school meals. We've made it a normal part of the day, just like textbooks and school buses. We've really added a layer of convenience for families that never participated in the school meals programs before. We have so many parents who are working multiple jobs and just trying to make ends meet, especially now after the pandemic, and having the confidence and ability to just know that you've got a healthy Montana grown school meal waiting for your kid for breakfast, lunch, and maybe even dinner. It just really takes a weight off these parents.
That sounds great. Thank you for sharing those numbers. I really appreciate having state numbers. It's so helpful when we're trying to look at these policies. Really appreciate that.
Absolutely.